Have you ever stopped to wonder if the pills sitting in your cabinet, the very ones prescribed to help you, might actually be stealing your memories? Every 66 seconds, another senior is diagnosed with dementia, and startling research now shows that some widely used drugs could be speeding up memory loss, even shrinking vital areas of the brain by more than 28% in just 1 year. Even more concerning, these are not obscure medications. Some are the very ones people take every day for routine issues like allergies or heartburn. Imagine taking something you trust, only to discover it could be quietly harming your mind. That's why it's so important to stay with me until the end of this video. We'll uncover the 9 most dangerous medications linked to rapid memory decline and dementia, one of which you or someone you love may already be taking. And more importantly, I'll share how you can protect your brain health before it's too late. Number 1. Anticholinergic polypharmacy. At the top of the list isn't just one drug, but a risky pattern, taking multiple medications with anticholinergic properties at the same time. The combined effect can severely impact cognitive health, especially in older adults. This problem often slips under the radar, yet it's one of the biggest contributors to drug-induced dementia in older adults. Common medications with anticholinergic effects include diphenhydramine, often used as Benadryl for sleep, oxybutynin for bladder control, and amitriptyline for pain or insomnia. Taken alone, each may cause mild memory issues, but when combined, their impact multiplies, creating a powerful attack on brain function. A 2022 study in Age and Aging reviewed data from more than 280,000 older adults and found that those with the highest anticholinergic burden, based on the number and strength of these drugs, faced a 120% higher risk of developing dementia within 10 years. In other words, their chances more than doubled compared to those with little or no exposure. The science behind it is simple, but devastating. These drugs block acetylcholine, a key neurotransmitter needed for memory, learning, and communication between brain cells. When the brain is deprived of it from multiple sources, neurons shrink, synapses are lost, and activity slows, creating a state that mimics Alzheimer's disease and often leads to misdiagnosis. What makes anticholinergic polypharmacy especially dangerous is its hidden nature. Many seniors and their families don't realize that common medications can carry anticholinergic effects. Since these drugs are often prescribed for unrelated conditions by different providers, they slowly build up over time. The confusion, memory gaps, or difficulty processing information that follow are too often dismissed as a natural part of aging, when in truth, they may be a reversible drug-induced condition. The good news is that addressing this problem is both possible and empowering. A thorough medication review with a doctor or pharmacist can reveal which prescriptions have anticholinergic properties. Using specialized tools, they can calculate the overall burden and design a safe deprescribing plan. This often involves tapering off unnecessary drugs and replacing them with safer alternatives. For instance, melatonin may be used for sleep instead of sedating antihistamines, or duloxetine may be prescribed for pain instead of riskier options. The most encouraging fact is that drug-related cognitive decline can often be reversed. Many older adults notice clearer thinking, better energy, and improved memory within weeks or months once the burden is reduced. It's proof of the brain's resilience when given the chance to heal. Number 2. Antipsychotics. Antipsychotics such as quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, were originally created to treat serious psychiatric disorders like schizophrenia and bipolar disorder. Over time, however, their use has expanded far beyond these conditions. Today, many elderly patients, especially in nursing homes or hospitals, are prescribed these drugs to control agitation, confusion, or behavioral changes linked to dementia. This trend is deeply concerning. Families are often unaware that their loved ones are receiving powerful antipsychotics, sometimes used as a form of chemical restraint to make patients easier to manage, rather than to treat an actual psychiatric diagnosis. The dangers are profound. A 2022 study in the Lancet Healthy Longevity followed over 25,000 older adults and revealed that those given antipsychotics for behavioral symptoms faced a staggering 71% increased risk of accelerated cognitive decline within just 1 year, even without any previous history of dementia. The risks don't stop there. These medications can also raise the chance of stroke, sudden cardiac death, and dangerous levels of sedation, which often lead to falls, fractures, and hospitalizations. In many cases, these outcomes force seniors into permanent institutional care, robbing them of both independence and quality of life. The reason these drugs are so dangerous lies in their impact on brain chemistry. Antipsychotics suppress dopamine, a neurotransmitter vital for mood, motivation, executive function, and memory. When dopamine levels are artificially reduced, the brain slows down. The result is emotional flatness, loss of initiative, and in many cases, a zombified state. Families often notice dramatic changes in their loved ones. People who were once lively and engaged may suddenly appear withdrawn, apathetic, or disconnected. It can feel as though their personality has vanished, even though they are still physically present. This is not only heartbreaking, but also preventable with the right approach. That's why families and patients must demand transparency. It's important to ask healthcare providers to explain why antipsychotics are being prescribed and whether they are truly necessary. In many cases, behavioral symptoms can be managed through non-drug strategies, such as establishing regular routines, reducing noise or harsh lighting, addressing untreated pain, or simply improving sleep quality. And when medication is absolutely required, it should always be prescribed at the lowest effective dose and for the shortest possible time to reduce long-term damage. Education and advocacy play a vital role in reducing the overuse of antipsychotics and protecting seniors from preventable cognitive decline. Number 3. Paroxetine, known by the brand name Paxil. This drug is a selective serotonin reuptake inhibitor, or SSRI, often prescribed for depression, anxiety, and related conditions. It is widely seen as a more modern and gentler alternative to older antidepressants like tricyclics. But here's the hidden danger. Paroxetine is different from most SSRIs. It carries significant anticholinergic properties that interfere with acetylcholine signaling in the brain, a chemical essential for memory and learning. Unlike other SSRIs such as sertraline or escitalopram, this makes paroxetine especially risky for older adults. A large 2021 review published in Frontiers in Psychiatry highlighted this concern. It showed that elderly patients taking paroxetine experienced measurable declines in short-term memory, verbal recall, and overall cognitive function compared to those on other SSRIs. Within just 12 months of use, seniors on paroxetine showed noticeable declines in recall and attention. The study revealed they were 30% more likely to develop early signs of cognitive impairment compared to those taking other antidepressants. It's a cruel irony. What's meant to stabilize mood and ease emotional distress can, over time, erode mental clarity and emotional balance, leaving patients battling both old struggles and new cognitive deficits. Because of these risks, the American Geriatric Society placed paroxetine on the Beers criteria, a trusted guide warning against medications that may be inappropriate for older adults. Yet, it is still commonly prescribed, often without a full discussion of its impact on memory and thinking. For seniors, the toll can be devastating: difficulty concentrating, forgetting recent conversations, or struggling to process information. These symptoms are easily mistaken for dementia or simple aging. The best step is vigilance. Avoid paroxetine when possible, and choose safer SSRIs such as sertraline or escitalopram, which don't carry the same anticholinergic burden and are far less harmful to cognitive health. Beyond medications, non-pharmacological approaches like cognitive behavioral therapy, regular exercise, and proper sleep can strongly support both mood and mental health. Adding B vitamins, especially B12 and B6, may also help regulate mood and protect cognitive function. For seniors already taking paroxetine, it's crucial to talk with a healthcare provider about safer alternatives. A carefully supervised tapering plan can ease withdrawal and safeguard long-term brain health. Now let's turn to amitriptyline, commonly sold as Elavil. Despite being an older drug, it is still widely prescribed for depression, chronic pain, insomnia, and even migraines.
At first, its versatility seems appealing, a single pill that addresses many conditions. But beneath this convenience lies a serious drawback. Amitriptyline is one of the most potent anticholinergic drugs still in use. By blocking acetylcholine, the neurotransmitter vital for memory, learning, and neural communication, amitriptyline directly threatens brain health. For older adults, especially with long-term use, cognitive decline is not just a risk, it's almost inevitable. A landmark 2015 study published in JAMA Internal Medicine tracked more than 3,400 adults over the age of 65 for a decade, focusing on the cumulative effects of anticholinergic drugs like amitriptyline. The findings were alarming. Those with higher cumulative exposure faced a 54% greater risk of developing dementia compared to those with little or no use. This highlights how the drug can steadily erode cognitive function, often without patients or families realizing the cause. Seniors prescribed amitriptyline for issues like neuropathic pain or sleep problems may begin noticing subtle shifts, forgetting recent conversations, struggling to find words, or feeling mentally clouded. Too often, these symptoms are blamed on aging, when in reality they may signal drug-induced decline. Even small doses taken consistently over years can trigger a slow, hidden deterioration in brain health. The risk builds silently, offering no immediate warning signs, which can create a false sense of security. Many patients continue their prescriptions unaware of the cognitive toll, made worse by healthcare providers who may not fully explain these dangers. For anyone taking amitriptyline, taking proactive steps is essential to reduce these risks. Consulting a physician to explore safer alternatives is essential. For nerve pain, medications like duloxetine or gabapentin can provide relief with far less anticholinergic risk. For insomnia, melatonin, or even low-dose doxepin, which has a milder profile, may support sleep without undermining cognitive health. When it comes to depression, newer antidepressants such as sertraline or citalopram are generally safer, helping stabilize mood without the same level of danger. A careful medication review, paired with a gradual tapering plan when discontinuation is needed, can preserve mental clarity and protect long-term brain function. Benzodiazepines, medications like lorazepam, Ativan, diazepam, Valium, and alprazolam, better known as Xanax, are among the most widely prescribed for anxiety, panic attacks, and insomnia. They work by enhancing the effects of GABA, the brain's calming neurotransmitter, slowing neural activity and creating a sense of relaxation. At first, they can feel almost miraculous, quieting racing thoughts, easing anxiety, and promoting much-needed rest. For many, benzodiazepines bring quick relief, making them a go-to for anxiety or sleepless nights. Yet this short-term comfort often hides a darker truth. With prolonged use, these drugs can become a serious liability, trapping older adults in a cycle of dependence and cognitive decline. A pivotal 2022 study in the British Medical Journal followed over 8,000 seniors for 6 years. It revealed that those who used benzodiazepines for more than 3 months faced a 51% higher risk of developing Alzheimer's disease compared to non-users. The danger was even greater with long-acting drugs like diazepam, which remain in the body longer and build up in fatty tissues, including the brain. This accumulation creates a state of chronic sedation, dulling neural activity, and weakening the brain's ability to form new connections, process information, and stay mentally flexible. Over time, this translates into memory lapses, reduced concentration, and emotional flatness, as though feelings themselves are muted. For older adults, the impact can be especially insidious.
Many describe it as living in a constant mental fog, feeling detached from both their surroundings and their own sense of self. What's often mistaken for normal aging or early dementia may, in truth, be the hidden side effect of these medications. The challenge grows even greater when trying to stop benzodiazepines. Withdrawal symptoms like rebound anxiety, agitation, tremors, and severe insomnia can be overwhelming, making it feel as though the drug is indispensable. Stopping suddenly is not only distressing, but dangerous, with risks that include seizures and other serious complications. That's why discontinuation must be handled with caution, always under close medical supervision, using a gradual tapering plan adjusted to the individual's history and dosage. The good news is that safer alternatives exist for managing anxiety and insomnia without the heavy cognitive cost of benzodiazepines. Buspirone, a non-sedating option, can ease anxiety without dependence or mental dullness. Cognitive behavioral therapy, especially CBT for insomnia, has also shown remarkable results by teaching practical strategies to manage both sleep and anxiety. Simple lifestyle changes, mindfulness, meditation, regular exercise, and consistent sleep routines add further support and reduce the need for long-term medication. For those already dependent on benzodiazepines, working closely with a healthcare provider to explore these alternatives and create a safe transition plan is critical. This not only preserves brain function but also protects overall well-being. Now, let's look at another group of widely prescribed drugs. Statins, such as simvastatin, Zocor, and atorvastatin Lipitor, commonly given to adults over 60. These drugs are prescribed to lower cholesterol and reduce the risk of heart attacks or strokes. For many, statins are seen as a cornerstone of cardiovascular health, credited with saving countless lives. Yet their effects on the brain are far less discussed, and the concerns are especially important for older adults. The brain itself is nearly 60% fat, and cholesterol is essential to its structure and function. It helps form the myelin sheath, the fatty coating that insulates nerve fibers and allows signals to travel efficiently. When statins lower cholesterol too aggressively, they may unintentionally deprive the brain of this critical resource, opening the door to cognitive problems. Research supports this concern. A 2023 study in Frontiers in Aging Neuroscience showed that seniors over 70 who used statins for more than 3 years had a 26% greater risk of developing mild cognitive impairment. Those on higher doses reported even sharper declines, sometimes experiencing sudden lapses like forgetting names, losing track of conversations, or getting confused on familiar routes. These effects can be subtle at first, often dismissed as normal aging. But when memory fog, difficulty managing finances, or trouble following instructions appear, it may be more than age. It could be a sign of statin-related cognitive decline. Not all statins carry the same level of risk. Lipophilic statins, such as simvastatin and atorvastatin, are more likely to cross the blood-brain barrier and interfere with cognitive function. In contrast, hydrophilic statins like pravastatin, Pravachol, and rosuvastatin, Crestor, are less likely to do so, and are generally considered safer for the brain. If you're taking a statin and notice memory problems or mental fog, don't stop suddenly on your own, as this can raise your cardiovascular risk. Instead, talk with your doctor about switching to a hydrophilic statin or lowering the dose. Alongside medication adjustments, lifestyle choices such as eating a heart-healthy diet rich in omega-3 fatty acids, regular exercise, and stress management can help lower cholesterol naturally and reduce the need for higher doses of statins. It's also wise to schedule regular cognitive assessments. Detecting early changes allows timely adjustments that protect your brain while still keeping your heart safe. Balancing cardiovascular health with cognitive function is key to aging well. Bladder control medications are another class of drugs that deserve close attention. Oxybutynin, commonly prescribed under the brand name Ditropan, is often used to treat urinary incontinence and overactive bladder. These medications can ease the frustration of frequent bathroom trips and the embarrassment of bladder control issues. but they come with hidden risks for the brain. However, oxybutynin belongs to the anticholinergic drug class, which means it blocks acetylcholine, the same neurotransmitter affected by diphenhydramine. While this mechanism relaxes the bladder, it can have serious consequences for brain health, especially in older adults. Unlike milder anticholinergics, oxybutynin easily crosses the blood-brain barrier, directly impacting the hippocampus and other regions tied to memory. This makes it particularly dangerous for seniors already vulnerable to cognitive decline. A 2019 study published in the BMJ found that adults over 65 using strong anticholinergics like oxybutynin for more than a year faced a 49% higher risk of developing dementia. That's nearly a 1 in 2 chance of cognitive impairment for long-term users, a staggering statistic that highlights the drug's hidden danger. What's most concerning is the lack of awareness. Many patients, and even some healthcare providers, remain unaware of its cognitive side effects. Seniors may start experiencing forgetfulness, trouble following conversations, or frequently misplacing items, often dismissing these symptoms as normal aging rather than a side effect of the drug. Family members might notice personality changes or increasing confusion, yet the link to oxybutynin is often overlooked until real damage has already occurred. If you're taking oxybutynin and have noticed cognitive changes, it's essential to bring these concerns to your doctor. Safer alternatives do exist. Medications like mirabegron, sold as Mirbetriq, work through a different mechanism that does not block acetylcholine. Because of this, mirabegron carries a much lower risk of cognitive side effects, making it a safer choice for older adults. Beyond medication, non-pharmacological strategies such as pelvic floor exercises, bladder training, or dietary changes can also help manage incontinence without compromising brain health. If you are considering transitioning off oxybutynin, it should always be done under medical supervision to prevent worsening bladder symptoms. By exploring these options early, you can protect both bladder control and long-term memory. Proton pump inhibitors, or PPIs, are another class of medications that deserve attention. Drugs such as omeprazole, Prilosec, and esomeprazole, Nexium, are widely prescribed for acid-related conditions, including heartburn, GERD, and ulcers. They work by reducing stomach acid production, bringing quick relief and protecting the digestive tract. For many seniors, PPIs become a long-term fixture, sometimes taken for years or even decades because symptoms return once the medication is stopped. Although PPIs are often promoted as safe and gentle, prolonged use can carry hidden risks for brain health. One of the most concerning is their effect on nutrient absorption, particularly vitamin B12. This vitamin is essential for healthy nerve function, stable mood, and preserving memory and focus. Stomach acid is essential for breaking down vitamin B12 so it can be absorbed in the intestines. When PPIs suppress acid production, they can gradually cause a B12 deficiency, which often shows up as memory lapses, confusion, or even depression. A 2016 study in JAMA Neurology involving more than 73,000 adults over 75 found that regular PPI users faced a 44% higher risk of developing dementia compared to non-users. The concern doesn't stop there. PPIs also reduce the absorption of magnesium and calcium, both critical for proper neural signaling and brain cell function. These nutrient deficiencies can mimic early signs of Alzheimer's, such as forgetfulness, poor concentration, and disorientation. Adding to the risk, long-term PPI use has been linked to the buildup of amyloid beta plaques in the brain, protein deposits strongly associated with Alzheimer's disease. These plaques interfere with communication between neurons, accelerating cognitive decline. For seniors taking PPIs over long periods, the combination of nutrient malabsorption and plaque accumulation creates a dangerous scenario for memory health. Fortunately, there are ways to lower these risks. If you take PPIs daily, talk with your doctor about whether tapering off might be safe. Stopping suddenly can trigger a rebound surge in stomach acid, making symptoms worse. A gradual reduction, sometimes supported by H2 receptor blockers like famotidine, Pepcid, can help manage digestive issues while reducing the impact on brain health. H2 blockers are generally less likely to disrupt nutrient absorption or harm cognitive function, though they are not completely risk-free. Natural options like deglycyrrhizinated licorice, DGL, can help soothe the stomach lining and ease acid-related discomfort without the same cognitive concerns.
Lifestyle changes, such as avoiding trigger foods, eating smaller meals, and staying upright after eating, can also reduce the need for long-term PPI use. By targeting the root causes of acid reflux and considering safer alternatives, you can protect not only your digestive health, but also your cognitive vitality. Diving into another common medication, diphenhydramine, better known as Benadryl, stands out. This widely used over-the-counter pill is found in nearly every household and is often turned to for relief from allergies, cold symptoms, or trouble sleeping. Its low cost and easy availability make it appear harmless. Yet behind its familiar pink coating lies a hidden danger for older adults. Diphenhydramine is part of the anticholinergic drug class, which blocks acetylcholine, a neurotransmitter vital for memory, learning, and alertness. By interfering with this critical system, what seems like a quick fix for sneezing, itching, or insomnia may quietly undermine brain health over time. The hippocampus, a small seahorse-shaped structure deep in the brain, is especially vulnerable to this kind of disruption. It is responsible for encoding and storing new memories, and its function becomes increasingly dependent on acetylcholine as we age. When diphenhydramine interferes with this neurotransmitter, the brain struggles to form new memories, often leading to forgetfulness, confusion, and mental fog. A 2023 study published in the Journal of Geriatric Cognitive Health highlighted just how serious this problem can be. Seniors who regularly used anticholinergic medications like diphenhydramine were found to have a 54% higher risk of developing dementia compared to those who did not. This startling statistic reveals the long-term dangers hidden behind what many people assume is a safe, everyday medication. The risk is even more concerning because diphenhydramine often hides in plain sight. It is frequently included in products labeled PM for nighttime or allergy relief. Medications like Tylenol PM, Advil PM, or generic sleep aids may contain diphenhydramine without clearly stating it, leading many older adults to take these drugs for years without realizing the cognitive harm building up silently in their brains. Symptoms such as difficulty recalling recent events, struggling to focus, or feeling mentally sluggish are often dismissed as normal aging. In reality, they may be signs of the medication's impact. To protect your cognitive health, it is best to avoid diphenhydramine, especially for long-term use. Safer alternatives for allergy relief include second-generation antihistamines like loratadine, Claritin, or cetirizine, Zyrtec, which are far less likely to impair memory and brain function. These medications are non-sedating and do not cross the blood-brain barrier, which makes them less likely to interfere with memory or cognitive function. If you've been using diphenhydramine as a sleep aid, it's wise to talk with your healthcare provider about non-drug solutions, such as improving sleep hygiene or addressing the underlying causes of insomnia. And remember, never stop any medication abruptly without medical guidance, as this could trigger withdrawal symptoms or make your condition worse. Always consult your doctor to ensure a safe transition if alternatives are needed. The key lesson is clear. Over-the-counter does not always mean safe, especially when it comes to protecting your brain. Today, we've explored 9 common medications that can silently harm memory and increase the risk of rapid dementia, from everyday drugs like Benadryl and PPIs to the hidden danger of anticholinergic polypharmacy. Now, I'd like to ask you, what's the most surprising thing you learned from this video? And how will you use it to safeguard your health? Maybe it's talking with your doctor about a medication review or exploring safer options. Thank you for watching and taking time to care for your health. Wishing you strength, happiness, and peace always.
And don't forget to subscribe to my channel, Healthy Aging Blueprint, for more insights to keep your mind and body thriving.